Hello, this is Patricia for Note Designer, Leaders in Psychotherapy Note Writing Software for Mental Health Professionals. In this video, I'm going to review the two most common report types that are important to include in any clinical record, the intake report and the termination report, sometimes referred to as a discharge summary. Please note that this will be more of an educational presentation explaining the different reports and not a comprehensive tutorial about using Note Designer itself. We do, however, have other videos that focus more specifically on how to use Note Designer and all of its options for customization, which you can find on our webpage or in the Help menu. Let's start by considering the first note typically included in the clinical record, the intake report. As the name implies, this report stands as our documentation of what transpired during the intake process, typically a report based on the first session or perhaps the first few sessions. We will use the intake report found in Note Designer as we consider what to include in this type of documentation. In Note Designer, the main sections of the intake report are marked by tabs that are conveniently located across the top. So here we see headings, presentation, background, assessment, themes, clinical impressions, contract and plan. The first tab, Headings, concerns all of the important demographic information we collect about the client. So we have the client's name, date of the intake, home address and telephone numbers, date of birth, occupation, the referral source. Usually we include an emergency contact number, CPT code, and the like. In the next section of the report, we might include some statements about how the client presents. So here we click on the Presentation tab in Note Designer. Now we can enter a number of different parameters. First, we have things like the location of the session and the client's appearance. That can include things like the client's punctuality for the appointment, if they were accompanied, as well as any noted aspects of their physical appearance. Keep in mind that we don't have to include all of these things, and much of what we choose to include will be based on our clinical judgment regarding the case, and perhaps also related to the setting in which we are working. The next part of the clinical presentation includes some statements about the client's presenting difficulties. That is, the difficulties that have brought them to seek treatment. Typically, this will include and focus on the subjective report of the client, but may also need to include some of our own observations during the intake. It usually includes such things as when the difficulties began, whether they have worsened or gotten better over time, and whether there is anything the client has done to address these issues in the past. We may also take note of any current treatments and any medications the client is taking. Next, we should give some mention of the history of the presenting difficulties, so some note about their onset, their course, and progression. Though it may already be included in what we have just noted, we may also want to document the client's reported affective state, as well as our own impressions regarding the client's affective state and mental or cognitive level of functioning, including perhaps observations derived from a mini mental examination. Of course, some of what we include in the report will depend on the particular clinical situation and setting. The intake report template in Note Designer was created to include a broad range of content that the user can choose from. You don't need to use all of what is included, just use what you need. The next section of the intake is the general background. This is where we would document, as needed, such things as the client's family background, any significant experiences from childhood, adolescence, and adulthood, as well as noting any relevant traumatic experiences, and perhaps a bit also about the client's medical history, any physical illnesses, injuries, hospitalizations, etc. Our intake report should also make some mention of any prior treatments the client has tried, along with what they have found to be most helpful and least helpful. Very important to know as we formulate appropriate treatment recommendations and treatment planning. An intake report also typically includes some documentation regarding any assessments we conduct and their relevant results. So in Note Designer, here we have the Assessment tab. It begins with some documentation regarding the client's assessed global functioning and their observed level of functioning, which is something like the HUDAS and of the DSM. Next, there is a sub-tab to make note of any assessment instruments we may have administered, such as a personality inventory, maybe a mood measure or symptom checklist, and then any relevant results. Typically, we do not report any raw data in the report and focus more exclusively on our own clinical analysis and overall results as derived from the data. Last in this section, we may also make mention of the client's response or reaction to the assessment or to the intake itself. Of course, what gets discussed during an intake interview can be quite complex and varied and often difficult to summarize. In Note Designer, we include a tab for themes discussed during the session that organizes possible topics into categories so as to structure and limit the content of our documentation. So here we have themes like relational issues, trauma, themes of mourning and grief, and so on. An individual practitioner may choose, of course, not to note the themes of the session. It's really at the discretion of the clinician and depends on the particular clinical situation. This content is included in Note Designer so as to give users maximum coverage. For those of you using Note Designer, please remember that you can like the content that you most often use by using the heart icon, and you can also hide content that you don't use at all. I'll also give a little reminder here that in Note Designer, you can customize the report to suit your particular clinical need. Check out our customization video to learn more about that. The next section of the intake report is where we document our clinical impressions. This may include such things as any clinical observations, diagnostic observations, and any relevant biopsychosocial factors. In Note Designer, there is also a sub-tab called Diagnostic Impressions, whereby you can note any psychological, psychiatric disorders you may have assessed, organized in a manner that follows the DSM. So, for example, we have neurodevelopmental problems, affective and mood disorders, traumatic reactions, eating disorders, and the like. If you do use DSM diagnoses, you can also note those in the text box provided, along with the associated numeric code if necessary. There is place here also for any relevant medical diagnoses. The last sub-tab brings us to our preliminary clinical formulation, sometimes called a case formulation. The clinical formulation is essentially our theoretically derived understanding of the client and their difficulties. It is a preliminary conceptualization based on what we have learned during the session that may include some ideas or hypotheses about the origins of the client's difficulties, how they got to be the person that they are, which can include biological, social, as well as psychological factors. The factors that may be maintaining and or contributing to their distress or diagnosis, as well perhaps noting how we may understand the client's relevant strengths and areas of positive functioning. Typically, how we conceptualize a clinical case will be strongly influenced by our theoretical orientation, areas of specialization, and our particular expertise. The next section of the report in Note Designer is referred to as Contract. This is where we document our different clinical recommendations, usually based on the clinical formulation we noted earlier. Typically, these are recommendations that we had shared with the client during the intake. And finally, it is good practice to make some mention of our contract for further treatment. So here mentioning all the topics we covered with the client about the parameters of the prospective treatment, such as the fee, cancellation policy, handling of holiday times, as well as confidentiality and its limits. And then we may also make mention of the informed consent process we used. For some, this will involve obtaining a signed consent, but this is something that varies depending on your local licensing board. In some regions, a verbal consent that is documented is acceptable. The last section of our intake report documents our treatment plan. Even if no treatment is recommended, it's important to document that fact. So turning to Note Designer, we have the final tab, Plan, where you are prompted to note the primary and secondary treatment goals and target outcomes, along with the time frame to meet these goals and objectives. There is also a sub-tab here to document further the general treatment plan for going forward and the time and date of the next session. For clinicians who need to create a more detailed treatment plan, Note Designer does also have a treatment plan note template. You can learn more about treatment plans in our video on specialized note types. The final step in writing your intake report is to please include your signature. In Note Designer, you can upload your signature or create one with our electronic writing pad, and export the report and upload it to your electronic file system. Or, if you happen to be old school, simply print it, sign it, and store it away in your locked filing cabinet. Now let's turn our attention to the termination report, sometimes called a discharge summary. As the name implies, this is the report that the clinician writes at the end of a treatment, regardless of whether the treatment ended after an agreed upon time, once goals were completed, or prematurely, as is sometimes the case. Let's now review the main sections of a termination report using the templates from Note Designer as our guide. So here we have the main sections organized as tabs across the top: headings, background, treatment summary, and recommendations. Let's begin with the headings and the relevant demographic information. So again, we include the name of the client, date of birth, and the date of the termination report itself. We should also document the dates of the first and last consultations, as well as the overall duration of the treatment, be it months or years. Sometimes we also mention here the original referral source. For those using Note Designer, you can of course add as many headings as you wish to customize your reports. The next section is found under the Background tab. Here we give a brief summary of the initial presenting difficulties and any other areas or concerns that we addressed during treatment. Then we want to document, as a reminder, the diagnostic impression and any diagnoses we noted at intake. You can simply refer back to your intake report for this. After that, we should mention the therapeutic goals and objectives we pursued during the treatment. And last, we may mention any biopsychosocial factors that were relevant to the case and to the treatment. This next section is the main body of the termination report and consists of the treatment summary. Depending on the length and type of treatment, this sometimes presents quite a challenge, as it can be difficult to put into words the complexity of a full psychotherapeutic process. So it's a good idea to break it down into manageable parts. We begin with a treatment overview. Basically, a brief summary of what the treatment was like and how it progressed, focusing, of course, on the most salient and relevant issues, such as the quality, as well as any shifts in the therapeutic relationship, the types of interventions used, significant responses to the treatment, and any outstanding issues that emerged. One way to approach this summary is to use a timeline approach where you mention a bit about the beginning of the treatment, something about the middle, and then a few sentences about the later part of the treatment. Next, it is useful to mention any gains and progress made, any goals and objectives attained, as well as any goals and objectives not attained. After this, we may make a few remarks about the limitations of the treatment. That is, what may have been lacking, or certain limiting factors that played a role in the treatment process. And then it is important to document any remaining difficulties or concerns. These sometimes involve new difficulties that the client may have experienced during the course of treatment, or possibly concerns that the treatment was unable to address adequately. When broken down into these sections, it makes the summary a little less daunting to write. Next, a termination report should make some mention of the client's response to the treatment. This can include your observations of the client's approach, responsiveness, and reactions to the therapeutic work, as well as any subjective reports or feedback provided by the client themselves. After this, we should document something about the nature of the termination. For instance, did the treatment conclude based on a mutual decision made in collaboration between therapist and client, the ideal scenario, of course, or did the client perhaps terminate the treatment against the clinician's recommendation? Maybe the therapist had to terminate the treatment prematurely due to a move or a personal matter, and so on. Related to this, we might also make note about the client's reaction to the termination. For instance, the client may have expressed gratitude, been excited to end the treatment, or may be very sad or angry about the ending, whatever reaction you observed or that was reported by the client themselves. As a last section of the treatment summary, we can note any observed diagnostic changes and can clarify, if necessary, the diagnosis at the point the treatment was terminated. So perhaps by the end of treatment, the client no longer met the criteria for a depressive disorder, for instance. You would want to mention that explicitly at some point in the report. This brings us to the final section of the termination report, the recommendations. So here we would document all of the recommendations that were made to the client at the end of the treatment, and/or any recommendations we may want to convey to any professionals involved in helping the client in the future. In Note Designer, we also include a section here for the discharge plan. This is often used in hospital-based treatments, but may apply in some other contexts as well. This could just be a very brief statement about such things as whether the client will be followed by their GP or some other mental health resource, whether they can contact you if needed in the future, or perhaps if you referred them on to some other service and what that service is. And finally, as with all of our professional documentation, please be sure to sign your termination report. Again, in Note Designer, you can upload your signature or create one with our electronic writing pad and export it and upload it to your electronic file system, or in the old school method, simply print it, sign it, and store it in a locked filing cabinet. This has been Patricia for Note Designer. Thank you for your interest, and I wish you all the best with your clinical record keeping. If you have any questions or comments about Note Designer, please feel free to send us an email at info@notedesigner.com. We are always happy to hear from you.